So I'd love to hear a little bit of maybe, I know your current role is looking a lot more at the AI side of things and CoPilot and what have you. But how do you see, the transition from where you're working in Power Platform? What's kind of your take on AI? How CoPilot's kind of coming into the future, and what kind of gets you excited about that? And the use cases that are really driving adoption, I suppose. What are the ones you're seeing out there?
Yeah, I feel like all the conversation that we've had around citizen developer programs and Power Platform communities, et cetera, um, I don't think they're going to be around for very long. And I think even citizen developers are going to quickly become something of the past because the technology is advancing so quickly that
Mhm.
it's at the point where users can just tell the machine what they need it to build.
Uh-huh.
And, I mean, let's be clear. It's called a co-pilot for a reason. You're still the pilot. The user is still the pilot. They need to be the pilot, and that should be something that always remains true. There needs to be a human in the center of that. But I think, the barrier that many organizations feel to being able to launch a citizen developer program or a center of excellence or a Power Platform community, we're going to see that come down because they're not going to need so many resources to staff that, if you will. And so that gets me excited because I work with a lot of clients that have all of the licensing and they're really not maximizing it. And so, in
Mhm.
healthcare, especially, that always makes me kind of go, ugh, because that's a pass through to the patient. Healthcare in
Yeah.
America is already extremely expensive. And so I hate to see when organizations are paying for something that they're not really utilizing. But having said that, totally understand the resource ask on the side of my customer to say, let's build a COE, let's launch a community, let's do a citizen developer program, let's develop your curriculum. Like that's a lot.
Yeah.
And so that part of AI gets me very excited. I think the other thing is that we're really starting to see so many use cases with AI where the patient's population health, people's longevity, proactiveness in healthcare is really going to change. And my personal passion, that just makes me so happy.